So we just sort of like forgot about the dots, and we want to make sure that you guys see that better in the camera. So if you look back here, bladder 36, bladder 37, bladder 38, bladder 39, and bladder 40. Distance wise, that's gonna be, it looks a little less, but this is 6 and these are 8. Again, if we take these, another way to do it is from here and then climb up, back up. I can move, we can argue that we need to move slightly lower, but that's still fine, okay? Bladder 36 is halfway between medial aspect of the thigh and lateral aspect of the thigh, right on the gluteal crease. And then we have the popliteal fossa. That is the line of the crease, a little bit in an angle. Between the two tendons, halfway, bladder 40, bladder 39, medial to the tendon of the biceps femoris, and then bladder 38 just above it. So far, we're clear. Let's go into the lower leg, which is very important. So, the most important thing to remember, that I haven't mentioned that, is that from the malleolus, which is here, the lateral malleolus, prominence is here, to the crease of the knee, we have 16. Okay, if I want to try to stay more the same, that makes where my thumb match or touch to be 8. Okay, when we consider finding points, it's important that we keep that math in perspective. So if we were to go on the bladder line, right, we have bladder 40 and then we have bladder 60, which we're going to describe in details in a moment. It's the same level as the prominence, if you will, of the lateral malleolus. So we can measure from here as well, okay? So that's our line for what we call the bladder distribution on the lower leg. You got to make sure that when we talk about finding the points here, because we have 55 and then 56 and then 57, let's make sure that we stay within the same line, right? So bladder 57 is on that 8 and 8 midline, right? But the definition is between the two heads of the gastrocs or the calf muscles. So we have the tendon of the Achilles. We can just follow up, and we can see that that's going to be approximately the area where we're going to be just between the two heads of the gastroc. So we have the medial head, which is more defined right there, and we have the lateral head, which is defined right here. Okay, so right there, that's a bladder 57, and it is 8 down or 8 up from the ankle. Okay, if we can check ourselves, let's see. Trying to use the same measurement. We're about there, but anatomically it feels about there. Now, let's use that mark as 8. Bladder 55, which is the first point below bladder 40, as we talk about the calf, is 2 tune out. That means that we can take that whole distance and put it into quarters, right? So we have 2, let's say, what? We have half and half from here to here, right? So that's 4 and 4. And that's 2 and that's 2. Let's use this little point. So now we have 4 quarters. And then we can find that area on the same line, right? Right through here, right there, right there, between the two heads. So the two heads actually they actually cross the knee joint and go and attach behind it. But there's two heads that form. The lateral head is going that way, and the middle head going that way. So there's a little bit of a divot here, which is usually a little tender right there. Okay, let's put our point here for bladder 55. It's a good point for a lot of local calf issues. If that's 2 below, approximately, you can see here, right? Then the remaining distance, if that's tall is 8, would be 8 minus 2, which is 6. So bladder 56 is halfway from 57 to 55. So it's going to be right there, again, on the same line. So we can put our dot right there. So we can get the dot. All right, see if that would work. Let's double check ourselves. Sort of like in the middle, you can argue a little bit more here or something. Okay, so 40, 55, 56, and then 57. Okay, now 57 and onward, the channel starts to go more laterally. Okay, so let's go with it. bladder 58, which is also an important point because it serves as a luau connecting point of the channel, is defined as one zone inferior and lateral. Another way to look at that would be if I'm going to ask our patient here to actually, no, that's fine. Just bring this one and push my hand a little bit, push a little bit. I don't know if this comes very much to life, but I'm trying to show that where the lateral gastrocs become more tendon-like structure, which is around there, that's what we call the tendinomuscular junction. That's where we're going to find bladder 58, maybe slightly higher right there. Go ahead, relax. And as I put that dot here, right around there, you can see it's about as soon. Some argue it's maybe a little bit more, but I really want to make sure that I'm staying within the reference of the tendinomuscular junction, so maybe slightly more here. Again, it's not exact science, but we're trying to do a good job. So 57, and then 58 is more on the lateral aspect right there. Okay. Now we have bladder 59. To find bladder 59, we want to be able to find the halfway point between the line of the lateral malleolus, right, which is defining where bladder 60 is going to be, to bladder 58. Sorry, my bad. Okay. So if we go back, just refreshing that in my head, bladder 57 is exactly 8 between the popliteal crease and the ankle level, okay, or the lateral malleolus. So keeping that, we know that bladder 59 defined as just 3 tune above bladder 60. Let's make sure that we are finding, if this is 8, that's going to be 4 and 4, right? We can argue that 1 below. There's a simpler way to go about it, which I like to do, and that is to use these measurements of 4 fingers together as a 3-tone measurement. It's commonly used and practiced. So we can go into the lateral malleolus, put our hands sort of like right there, and then we're going to be able to go to the same line that connects bladder 58 and bladder 60. So you can tell that it's about where I was, right around there. Let's go a little bit here. The definition again is 3 tune exactly above bladder 60, on the line that connects bladder 60 to bladder 58. Okay, so we have that too. So again, in retrospective, we have bladder 40, bladder 55, bladder 56, bladder 57 between the two heads, going laterally to bladder 58, down to bladder 59, which is exactly 3 out from bladder 60. Let me just mark bladder 60. I think it's going to be helpful. Bladder 60 is literally, if we take the Achilles, let's bring it up a little bit like so, and the definition where the anterior border of the Achilles ends, it's right there, to the prominence, we're going to go about halfway, right there, the same level. So we're going to find it here again. Anterior border of the Achilles, where my fingernail is digging, the prominence, halfway, right there, we're going to find bladder 60 in the soft aspect on that line. And then when we do this one, we're right at bladder 59, which is on the line that connects with bladder 58. Alrighty, let's put a pause here.